Founded in 1985, Mission Foundation is the main fundraising organization for Mission Health System. To date, our donors have helped raise over $150 million for the community, for the hospital, and for its caregivers. Mission Foundation has been instrumental in the creation of many community outreach programs that help enrich the lives of residents throughout our region. Programs like Camp Bluebird for cancer survivors and the Tooth Bus for school children throughout Western North Carolina.
Camp Bluebird is a 3-day retreat for adult cancer survivors, and it is a 3-day retreat of love and comfort and laughter for people who have been diagnosed with cancer of all sorts, and they just get to go and be themselves and just be surrounded by love.
I'm Carolyn Camo, and I was diagnosed with breast cancer in 2007. Camp Bluebird has been a very important experience in my healing, both physical and emotional. And I have found that echoed time and time again every time I've gone to camp. You know, we talk about our fears. It's very real and it's raw, but it's also fun and hopeful.
The Tooth Bus program goes into outlying counties in Western North Carolina and provides care at the school for the children during the school day. Because of Mission Foundation's help, we've been able to actually set up 2 tooth buses. Anything that you would do in a traditional dental office is done there on the tooth bus. You don't see many of these programs across the country, and they really do make a difference. And Western North Carolina needs this program.
Over the years, the Foundation has played a vital role in providing services across the health system, including the Child Life Program, the Pet Therapy Program, and the Mama Emergency Airlift Program, all of which would be impossible without the help of our generous donors.
Merrick was just diagnosed. I'm Merrick's mother. Merrick was recently diagnosed with leukemia, and the day that Paul and Trish came in, Merrick was still in a little bit of a mood, still angry, having a hard time. But then Jolly jumped up in the bed, and that's all she wrote. So they got along really great from then on. It's a little bit lighter in the room. It's more peaceful. He's a little bit lighter.
When it comes to expanding the Mission Health facilities, we've played an important part in the construction of many new buildings, including the SECU Cancer Center, a state-of-the-art NICU facility, the Owen Heart Center, and the Reuter Children's Outpatient Center. The Foundation is poised to play a critical role in funding Mission's future, especially through the development of new programs like genomic medicine and new facilities like the planned expansion on the Mission campus to consolidate all patient services in one convenient location. Finally, the Foundation realizes that the most integral part to the success of Mission Health is the caregivers. That's why we've also helped create funding for certification, scholarship, and continuing education programs, along with an employee emergency assistance fund.
Mission Bell Scholarship annually provides 5 scholarships to rising senior nursing students within Western North Carolina. For some of them, it is the difference in whether they are able to stay in school or not stay in school. The Foundation is the reason as an organization we are in existence.
The infant transport team nurses is just another example of neonatal intensive care nurses who have a higher level of education and expertise and critical thinking skills in order to be far away from their home unit. Our nurses receive a lot of support from Mission Foundation and from Mission hospitals to go back to conferences, to increase their knowledge base, to keep striving to have more expertise in order to give our patients the best care.
The Foundation Employee Emergency Grant Program has been around since 1997. I think the benefits of the program are supporting employees in their time of need.
It was about 9 o'clock that morning where I was starting to feel a little weird, and I felt like I was going into preterm labor, and I was about 34 weeks. So we ended up going to the hospital, and they did an ultrasound, and they said by the time that I got to the hospital, she had passed away already.
They lost their infant daughter, and they came to us for assistance with her funeral expenses, and we were able to help provide that.
They actually ended up paying more than we thought. They paid $1,800 of the funeral costs, and we were like, whoa, like we did not expect that to happen at all.
The program helped them because no parent is prepared ever to bury their child, especially not when they're a newborn.
It took a lot off of our shoulders, and I think we would have had a harder time with the passing of our daughter if that would have had to have been over us still.
During these times of major change in American healthcare, Mission must maximize its ability to raise funds, receive grants, and encourage gifts of all sizes. We need every resource we can find. That's why we're now asking you to become a friend of Mission by volunteering, making a financial contribution, or telling your friends and colleagues about Mission Foundation and the role it plays in all of our lives. Thank you.
I feel so much gratitude toward the foundation because it literally would not exist without them.
I don't know, I think that it's something that's really good. You know, I didn't know that the Mission even did anything like that.
It helps employees in their time of need, helps them to stabilize their personal life or their home life.
It could not perform in its current state without the community and people supporting and donating money to the foundation.
Without the Mission Foundation, there wouldn't be a tooth bus program.
So without the community's support to the foundation, we would not be able to give the care to the babies and the families that we want to give. So we are so grateful to the community for all the support.